Hey there, and welcome. Today we're going to jump right into osteoarthritis. You've probably heard of it, right? It's by far the most common type of arthritis out there. People often call it the wear and tear disease, but you know what? There's a whole lot more to it than just that.
So, the big question is, what's actually happening inside our joints that causes all that widespread pain and stiffness? Let's dig in and find out. Okay, so at its heart, osteoarthritis, or OA for short, is all about cartilage breaking down. Imagine this smooth, kind of slippery cushion on the ends of your bones. That's your cartilage. When that cushion starts to wear thin, well, the bones can start grinding against each other, and that's what brings on that classic pain and stiffness.
Right, so to really get a handle on OA, we've got to look at who's most at risk and why. Let's break down some of the most common risk factors.
You know, OA can pop up in pretty much any joint, but it definitely has its favorites. Look at this. The hands are actually number one, which kind of makes sense with all those tiny, constantly moving parts. And right behind them, you've got the big players, the knees and hips. These are our major weight-bearing joints, and they take a real beating over our lifetime.
So when we talk about risk, it really boils down to two buckets. First, there's the stuff you just can't change, the non-modifiable factors. We're talking about your age, your sex, and the genes you were born with. But then, and this is the important part, there's the other bucket, the modifiable stuff. This is where you actually have some say. Things like keeping a healthy weight, trying to avoid joint injuries, and even the type of job you do. These are all huge.
All right, so we've covered the what and the why. Now let's get into the how. Like, how does this actually feel in the body? We're going to take a quick tour of the joints to see exactly how these symptoms show up.
First stop, the hands. This is where OA shows up most often, and you might hear it called nodal arthritis, and you're about to see why.
Yeah, some of the classic signs are these little bony bumps you can actually see on the finger joints. They're called Hibberden's and Bouchard's nodes. You might also notice a kind of squaring look at the base of the thumb. But here is an absolutely critical clue. The morning stiffness is super brief, like it's gone in just a few minutes. That is a huge difference from other conditions like rheumatoid arthritis.
Okay, let's head down to the knee. This is another big one, and OA here can be really, really tough on mobility. With knee OA, the pain really acts up with activity, right? Like climbing stairs or just getting up from a chair. And that grinding or crackling sound you might hear or feel, that has a name. It's called crepitus. If it goes on for a long time, you might even see some physical changes, like a bow-legged look or the thigh muscles getting weaker because, well, your body is trying to protect itself from the pain. Next up is the hip, another joint where OA can seriously get in the way of life. It's so common, in fact, that total hip replacement has become one of the most successful surgeries out there. Pretty amazing.
So, the classic sign of hip OA, it's often this nagging ache deep in the groin. And you see the pattern here, right? The pain gets worse after you've been active, and then it gets better when you rest. And just like we saw with the hands, that morning stiffness is short-lived, usually less than 30 minutes. So with all these symptoms, how did doctors actually figure out if it's osteoarthritis for sure? Well, the answer might not be what you think.
A lot of people think you have to get an X-ray to diagnose OA, but that's actually a myth. For a typical case, major health guidelines are really clear. Imaging is not required. It's just not needed to make the call. For most folks over the age of 45, the diagnosis is what we call clinical. That means the doctor can figure it out just by listening to your story. If you've got that classic combo, pain that's tied to activity and morning stiffness that's gone in under 30 minutes, that's usually all they need to know. But, of course, X-rays still have a role. A doctor might order one if your symptoms are a bit weird, like, say, a lot of pain at night, or if things are getting worse really fast. It's also super useful for ruling other things out, or for, getting a good map of the joint before a surgeon goes in. Okay, so you've got the diagnosis. What now? Well, managing OA isn't about finding one magic pill. It's really a layered approach, and it all starts with a super strong foundation that has nothing to do with medicine. The absolute foundation, the cornerstone of managing OA, is all about lifestyle. Seriously, first up is education. Just understanding what's going on gives you so much power. Then it's things like weight management, specific exercises to make the muscles around the joint stronger, and just general aerobic fitness. These are your first and honestly, your most important line of defense. Now, if those lifestyle changes just aren't cutting it for the pain, then we start to climb what's called the pharmacological ladder. Step 1 is usually a topical cream or gel, like an ibuprofen gel, that you put right on the sore joint.
If that's not enough, a doctor might talk about oral pills. And for a bigger but shorter-term fix, there are steroid injections that go right into the joint itself.
And then, for people with really severe persistent pain where nothing else has worked, that's when we talk about surgery. Joint replacement is an incredibly effective option at the end of the road. It can be a total game changer for pain and getting your life back.
Before we finish up, there's one last, really important thing I want to clear up. It's a condition with a similar name that can get confused with OA, especially when we're talking about knee pain.
So what happens if the person with the knee pain isn't in their 70s? What if it's a teenager who plays sports all the time? See, this is where context is everything. This completely changes the game and points us to a totally different diagnosis, osteochondritis dissecans, or OCD. And when you put them side by side, the differences are just night and day. OA peaks in people over 70, OCD peaks in kids and teens. OA is about the cartilage wearing down. OCD, that's actually a problem with a bone right underneath the cartilage, usually from repetitive micro-injuries in sports. This leads to totally different symptoms too, like the joint locking up or catching, something you really don't see with classic OA.
And at the end of the day, getting these distinctions right is the first, most critical step to getting the right treatment. So, think about everything we just went over. What's one thing you learned today that you feel like you could pass on to someone else? Thanks so much for tuning in.